Is laughing gas or happy gas used less frequently now compared to other forms of sedation?
I think it depends on case by case. If a patient has kind of mild anxiety, we would go for inhalation sedation. We could try it out, and if it's not effective for the patient and they're still quite anxious, then we can go for a different form of sedation. So that involves potentially giving them an oral kind of sedation, which is a medication that we give to them an hour before the procedure, which will make them really nice and calm when they come in for the procedure. Or we can do intravenous sedation. It really depends on the severity of their anxiety and how they get on with it. There are some adult patients who do really well with inhalation sedation, and there are some that get IV sedation and they really struggle even with that. Sometimes we can do a combination. So I once treated a patient where we gave the inhalation sedation in order to put the line in, essentially, for us to be able to put the medication for the intravenous sedation, and then we switched to the intravenous sedation after that procedure was done because they were just so anxious about needles.
So you can kind of use both.
You can use a combination of both. They won't be at the same time, but it'll be before, and then we can move on to something else. But it really just depends on the patient and their response.